All right, so this will be our second recording. And now we're going to talk about the shoulder girdle on 219. And in lab today, I want y'all to go ahead and hit that scapula Y, shoulder joint, scapula Y for the scapula. Do it. Start practicing. We'll go over it in lab, but do it. I may not cover it in lecture today, but that's okay. You've had a heads up. You've even had a quiz on it. So let's go ahead and get that going, practicing it. Okay? 219. Shoulder girdle, chapter 6. All right. All right, shoulder girdle is going to include 3 different complete bones. It's the what? Humerus, the scapula, and the clavicle. You got your 1 through 9s. All right. This on page 227 is, let me make sure she got the right page, as she does. This is the most important thing in chapter, is this 6 in y'all's book? Chapter 6 for shoulder joint. This is the most important page in the book. You have to know how the little man is standing. You have to pay attention to the placement of the hand, and you have to correlate this to what image or what projection of the shoulder you're doing. Internal, external, and neutral. All of that is dictated by the placement of the hand. You can tell it by the palpating the what? Epicondyles again. Okay? And you'll have to be able to look at the image of a shoulder, and you're going to focus on, you just looked at the humeral, the proximal humerus. We had the greater and lesser in profile or being demonstrated. You remember that? It's the same thing here for the shoulder joint. But it's all about the placement of the hand. What are we doing? Aren't we changing it as we, yeah, everything's changing. So this is the most important. There's descriptions. I'm going to, it's on table 6-2. I don't know if she's got this in here or not. I don't think she does. But make sure, if you do nothing else this afternoon, you read this. You tie this in. They got the picture. They got the x-ray. They got the placement of the hand. And they have the description. This is the 3 views of the shoulder all on one page. Obviously, once you do this, right, or neutral, you just let the arm hang. You center over the what? Humeral head, beep. Then I roll my hand out, beep. Then I roll my hand in, beep. I just gave you shoulder joint. Nothing to it. This is memorization. This is looking at the placement of the hand in relation to the image. It's all on the same page. So if you study nothing else today, this is the homework you have. And who knows, I might have another quiz coming up. So what you're going to do, you're going to study that. We can practice this in lab. We're going to talk a little bit about it if I have time. What time is this class over? Oh, God. All right, we'll make it. I'm gonna do the shoulder and we're going to stop, but I told you to do scapula Y for shoulder joint and scapula Y for the scapula. Okay? That was the quiz. Okay? Y'all should know it. So we're going to start practicing it. And I'll pick it up next time and lecture over it, but one of y'all, Zoria's lecturing next, is it Thursday? She'll be lecturing for me. You ready? I told you were going to be doing this. All right. So let's see. A, B, A, well, they got A, okay. A, B, A, B. All right, the top one, supinating and adjusting the epicondyles parallel to the plane of the IR. How many times can we hear this? That makes you think what? AP elbow, AP arm, right? And now we're talking about joint. So the epicondyle should be with the coronal plane passing through them, makes them parallel. And now I want you to look over here on the image. What's being demonstrated in profile? The greater tubercle. You see the big bump on the outside? You see the, I got my little thing. Well, she don't have it in here. Let me see. I thought she'd have had a little, I wanted her to put the little, no, she didn't. All right, it's okay. I want her to put that exact image there. But you can see where the little arrow is pointing at, and it makes that big, big hump. That is the greater tubercle end profile. And that is done with what? External rotation. That's what you want to tie together. You got all this, right? All we need to know is that it is what? External. That means turning it just a little bit. Your hands are supinated, but you're going to pull it just a little bit away from the body. Make a little stress there. And that's going to help clear that greater tubercle. And then the palm against the hand. The epicondyles are at a 45 degrees. So they're not quite what? Parallel. They're not quite perpendicular. They're at an oblique. Okay? And it says this is considered neutral rotation. So the hand just hangs. You just hang the arms and just let them flop. That's neutral. Most hospitals do not want neutral. They want internal and external. Must be for a reason. The neutral really doesn't show that much. I think if I'm saying it right. All right. So let's see that neutral rotation. It says neutral rotation. Your greater tubercle. It's there, but is it as clear as the one that we just covered? Not really, huh? All right. Posterior aspect of the hand placed against the hip and the epicondyles adjusted perpendicular. So you're going to be doing this, right? There's my epicondyles are perpendicular. That's to the plane of the position of the humerus in internal rotation. And it says the internal rotation humerus, greater tubercle, lesser tubercle end profile. So that is for the lesser tubercle. Lesser tubercle, you see the triangle that, dang, I got an image. Let me see if I can find them. All right, this is external. Is that the one we're looking for? No, one. This is the external, internal. Is that it? Internal rotation. Y'all see this right here? See this triangular looking thing right here? That is your lesser tubercle end profile. And it's projected what? Medially. It's projected, it's pointing towards the body. So I don't see how you can get this one. And let me see if I can go up to the other one. The external. Here we go. Let me hit this one. Look, this is greater. Greater's on the what? Lateral or the outside. And the other one was the medial. Yeah. See it? And also look at the amount of glenoid cavity overlap. Y'all see this? Y'all see this circle right here? That is part of the glenoid with the humeral head, so it's lighter because that's two bones. That's the glenoid cavity and part of the humerus being superimposed, so they attenuated more x-rays, so they demonstrate as a lighter gray. So we have a lot more of the humeral overlap on this one. That's always a question too. All right. So I'm on page 239. We're going to go back through this real quick, and then I'm going to stop. All right. So we're at AP, neutral rotation. Well, what am I doing here? External. All right. Let's go with external rotation, 1 through 9. Shoulder girdle. Am I going the wrong way? Yeah. All right. Epicondyles are external rotation. Epicondyles are parallel. Central ray is 1 inch inferior to the coracoid process. Where's that at? What's the coracoid come off of? No, there's nothing off the clavicle. Scapula, it's the anterior projection of the scapula. The acromion is projecting off of the back. The coracoid is projected off of the front. When you go to lab, get a scapula, look at it. So you'll be able to appreciate that finger-like projection of the acromion. You can see it, their coracoid. You can see it right here, how it kind of loops up. It's actually projected forward. It's very hard to palpate, but it's right underneath the clavicle. If you push on it, it hurts. Mine's right there. Put your hand right there and just start pushing your shoulder up, and you'll feel it. There's a knot. That's the coracoid. as you move your shoulder, you can feel it. Did you feel that, Tessa? That was a very gentle touch. But fall right out, right underneath the clavicle and start rolling your arm and you'll feel it move. There's a little knot. Any type of movement, you'll feel it. That's the coracoid, okay? It says 1 inch inferior below that spot. So if it's a 1 inch, I would say 2 inches from the top of the what? Margin of the shoulder will get you there, okay? This is the external evaluation, clavicle, acromion. There is your coracoid process right there. Here's your joint space. There's the glenoid cavity, the humerus. Greater tubercle projects laterally. You see the big bump, right? You see the lesser, and you see that big old hill there, and then you see the little tunnel in between it. So you know this is the greater, and it's projected lateral, right? All right. Internal rotation. She has her back of her hand. You want to make sure that the epicondyles are perpendicular. It's 1 inch inferior, the same as the other, right? All of them are going to enter at the same spot. Here we're going to have the lesser tubercles, and it is pointing medial towards the body. All right, that's going to be the two difference, and it says lesser tubercle profiled medially. Anytime it says what? Profile, we stop, we look, we highlight. If we don't know it, we go to the front of the book and we look it up in the anatomy section. It's a test question. Everybody good with that? All right. Internal rotation. Okay, look at these two. Internal versus external. Can you see the difference? This is what? That's lesser, and it's pointing medial. This is, all right, so everybody understand that. And that's all in relation to what? Epicondyle placement and the hand placement. Everybody good with that? All right, there they are again. I got a bunch of these coming up. Okay, AP neutral. Neutral rotation. You see anything really? That's the greater, but is it in profile? Is it really projected out? It's really over the what? The humeral head. You really don't see that much there. That's why I said most doctors don't want a neutral. They want you to do the internal and external. All right, scapula. Why do we even go there? Do we even go there? What do we got? Got time. All right, let's look on 220. It's not 243. I'm sorry. I'm looking at the next slide for the anatomy. All right, shoulder joint, scapula Y. Everybody see the Y? Everybody looked at this over the weekend. Saw the Y. All right. What is this here? The anterior projection. Coracoid. Yeah. Here's your what? Clavicle, and it articulates right in here with the AC, acromion clavicular joint. So you have the AC joint up here, right? So it actually curves backwards. This is why you can't really see the articulation in this profile. All right. So what is this right here? Well, I guess I should say right there. What is this? Glenoid cavity. And that is on the lateral aspect of a scapula. So if we took the arm off and we turned you sideways, we'd be able to see the glenoid cavity. Because that's where your humeral head's going to articulate and create the what? Sydney? Wait. Glenoid cavity, I just cut your arm off and turned you. I see the glenoid cavity now, right? What would have been there? The humeral head, and it articulates with the glenoid cavity to create the shoulder joint. Very good. The joint. Okay, but we have a shoulder girdle and we have a shoulder joint. We do specialty views for the shoulder joint. We do specialty views for the shoulder girdle, depending on what we're looking at. All right. Here's just a anatomy. I think this may be in your book. This is what we're after. You see how the coracoid projects anteriorly, and you see how this acromion, it goes out to the back, but it curves up. So it's going to articulate with the clavicle right here. That's why it was kind of hard to see it, because it turns back over up on itself. And that's where, and your clavicle would come right in here. All right. There's your glenoid cavity. It's facing lateral, right? All right. Pay attention that it has a superior border. It has a lateral border, and it has a medial border. There's 3 borders. You have to know them. And if you read the article, that's what they talk about, the 2 borders. Which one's the thickest? Here's your outer one, or the what? This is the medial, and this is the one on the lateral outside. So which one's thickest? Look at the image. It shows you. Doesn't this look thicker than that? So when you're looking at them like this, right, you should be able to see, they're not completely superimposed. You should be able to see one clean line, or you see a double line. If you see the double line, you're looking at what border? The thicker of the 2, which would be what? The lateral. That's what the article talks about. I even highlighted it in yellow for you. You're welcome. Read the article. You know what article I'm talking about, right? I attached it to the email, or did I post it in Moodle, or did I do both? I'm overkill. I did both. Yeah. Okay. There's your borders. They're going to become important. Here's a whole slide. It says exactly that. The medial is also known as the vertebral vertebra because it's closest to the what? Vertebra means what? Say it again. What does vertebral mean? Vertebra, what does it mean? Yeah, it's closest to the what? The spine. Axillary. What does axillary mean? Arm, axilla, armpit. So it's closest to the what? Armpit, or the outside, the medial. Just letting you know, they're also called 2 different things here, not just medial and lateral. On my test, I will have vertebral and axillary. They're on my PowerPoint. They'll be on my test. So don't say, oh, you didn't cover that. I just put it on my PowerPoint. Baby, I've been doing this for 22 years. I know what I'm doing. I know what my tests say. No, I don't. I don't even build the tests. I have nothing to do with that. Not my thing. Here is what perspective are we looking now? Look, straight at your side with your arm removed. Looking at a lateral aspect. Look, this is projecting what? This is the anterior. This is the posterior. So you can see the 2 processes. Now you can appreciate the Y here, right? This is the one leg. Here's another leg. This is the center, the junction of the Y. And here's your 2 borders superimposed. So that creates the scapula Y. Somebody give this back to me. All right. Who's looking? Where's your card at? I can't see it behind Tessa. Where's your card? I can't see it. I wanted to say Hannah and Hannah. All right, Hannah. Go. What did I just say? Don't you hate when I do that? I was looking at this anatomical view and I said, can you see the scapula Y? And I said, it's right. The acromion, it's the coracoid, because these are called processes, right? And then we have the center of the Y, which is the junction of all 3 arms of the Y. So these are your 2 upper extremities of the Y, and this is the leg of the Y. And the leg of the Y is made up of the 2 borders of the lower portion of the scapula, the medial and lateral, or axilla and vertebral borders. So they're superimposed here, right? Can you see the Y now? Okay, we'll see. All right, there is your scapula Y. She's got page 262. She says she updated this. Let me see if that's true. Yeah. All right, this is scapula Y trauma shoulder, but I'm still on trauma shoulder on 243. The 262 is actually scapula Y for scapula, I believe. Is that true? 45 to 60. All right, it says on page 243, we got 10 minutes. All right, so here we are, PA oblique projection. Your article tells you about the obliquity. There was some argument about it being a 60-degree versus a 45 from some other study. And then they did another study and they came in and they decided that 45 will get you that scapula Y. It wasn't going to be the range like they were saying. I think it was a 60, very, very steep. It all depends on the body habitus. And when we get in lab, I'll show you how to do that. You just place your hand on the back of the person and you turn them until your hand goes perpendicular to the IR so that you know the two borders are superimposed. So we'll do that in lab. It's a quicker way of doing it. All right, so this is patient is being done what? PA, the projection is a what's the I want to say projection. What is the position? A what? RAO, right. And when you're doing on PA, it's the same side. In other words, her injured arm is on the right side. So RAO, PA oblique projection demonstrates the right. So when we flip this and do them AP, RPO demonstrates the left. Just 3, 4, oh yeah, just lost them all. Remember, anything we can do one way, we can do the other. So when you're doing scapula Y for in the PA person standing PA, shooting from the back, it's the shoulder that's touching is the injured shoulder. All right? When you're doing on AP, the uninjured shoulder touches and you're after the one away. Y'all got me? So this is what R, and I'm PO, right? I would have been RPO, demonstrates the left. RAO, PA demonstrates the right. Anything you can do one way, you can do the other. Rapides does everything AP on the table when they're doing shoulder work. Everything is done, not standing like the preferred. Everything is done on the table. They do their shoulders. You can do them standing. A lot of my students do, but senior technologists do it all on the table. So would you roll them on their stomach to get them in a PA in order to do a scapula Y if they're on the table and they got shoulder injury? Or are you going to flip them over after you've done your AP views of the shoulder? Okay, ma'am, now I need you to roll on your stomach and onto your injured shoulder so I can get a picture of your scapula in a Y formation. Are you going to do that? It's for the comfort of the patient. You're going to do the one away. So they roll on their good shoulder and you're going to do the one that's injured. It's going to be up. What's it going to look like being up off the table? PAs are like this. APs are like that. What's causing it? OID. Very good. Who said that? Look at you. Yeah.
I watched your video.
You watch one of my videos on this one? On YouTube or on Moodle? It's strictly over this, isn't it? Smart girl. Whole video dedicated just to the scapula Y. Yeah, pretty good. All right, good job. Any questions? Any questions? All right. What do we have? What do we got left? Shoulder, we've done internal, external, neutral. We've done humerus, AP, lateral. We did transthoracic, right? So what do we have left? We've done scapula Y for what? Zoria, which one did we just do? 4. Scapula Y for what?
Dislocation.
Okay. Scapula Y for shoulder joint. Because the arm placement was irrelevant. You could put that arm anywhere. In the article even talks about it. They used to do this. And then they realized when they were doing that, it did require more obliquity. And it says when they took the arm down, the obliquity was down to 45 for most patients. Read the article. I posted it. I highlighted it for you. Explains all this that we're talking about. One article. What, 3 pages? I even highlighted it. It tells you what's important. All right. So y'all want me to stop here? Is this enough for a lab? Because when y'all come back when Thursday, we'll do clavicle, we'll do scapula, and that's it. AC joints. We can do AC joints. Acromioclavicular, we do those. Very easy. Center over and shoot. Not hard. All right. I think that's enough. So I'm thinking stop the recording now, and this covers your shoulder to include scapula Y for shoulder joint. Then we'll do scapula Y Thursday but practice both of them today. Did everybody hear me say that? Practice it all today. Don't worry about the clavicle. Don't worry about the scapula itself other than the scapula Y. Because I want you to understand arm placement. It's irrelevant when you're doing it for what? Shoulder joint. It's relevant when you're doing scapula Y, obliques. They call them laterals. Because you have to get the arm out of the way for what you're demonstrating. So if this is going to be superimposed over what part of the scapula? Superior border or the 2 processes. So you don't see the coracoid or the acromion because my arm's in the way. So when this pops up on your image critique, all you should see is what? The body, the board. Yeah, the 2 borders. So what's this? Where's the arm? Superimposed over the what? The body. This is clear. So your friend is on your test is going to be what? The arm. In everything we do. You're going to be looking at the greater and lesser tubercle for the shoulders. You're going to be looking for the arm placement for the scapula Y for shoulder joint or for the lateral views of the scapula, right? Placement of the hands. You're going to see the epicondyles for the AP humerus, lateral humerus, transthoracic. We did that one too. Studied that. Miss McKnight, are you doing the lab today?
Yes, sir, and I was gonna ask if everybody had tried to submit their, discussion board again.
To submit it? They said refresh it and it'll let you do it. Let you retype it or let. Okay, they said if you refresh it, you'll have to retype it and submit it. Or if they have it on paper,
Okay.
you can just pick it up on paper.
Okay, when do you want the deadline for that to be?
Nah. What time
I
is
have
it
it
now?
set to 1 o'clock today, right now.
Yeah, do it before lab today if you, I really want them to do it. I tell you what, do it with me at 1 o'clock. How about that? Can we do that? It's not fair to
You
let
at
them leave
1?
your
Okay, so
books.
I'll make it through 2 o'clock just to be safe.
So when you come back to lab, for those that haven't submitted, come back in, sit down, jump on your iPad, type it and submit it. Okay, she said it's letting them submit it right now, so hopefully those, how many don't have iPads? Don't.
I gotta get mine, getting
Getting it, all right. Because I was under the impression our next test is supposed to be iPad. Did I read that somewhere on an email from Dr. Curtis or Mr. Spino?
We have
or
about
someone?
still missing, but,
How
one
many
said
are,
hers-
how many do you have, Angie?
4, and one of them said that hers is coming in this Wednesday.
Okay, so hopefully we'll be okay by next week to start doing that, all right? I'm stopping the recording, guys, so we'll have 2